Hey there, welcome to my 5-part series on child anxiety. If you know me at all, you know that I love helping parents help their anxious kids. So in this series, we are going to talk about signs of child anxiety and what parents can do to help their kids crush it. Stay tuned, that's what's up next. Part 1 talking about the missed signs of child anxiety, because the obvious signs, parents get that, but there are a slew of missed anxiety signs that parents do miss, and I see that all the time in my practice. So let's talk about the missed signs of child anxiety. The first one is the stomach and other physical issues. So if your child is having a lot of stomach aches and the doctors are saying there's no medical origin, you want to take a look and think that it could be possibly anxiety. I have so many kids come to me in my practice that have gone to the gastrointestinal specialist, they've been scoped, they've had a lot of invasive procedures only for all the medical professionals to tell them, you need to see a therapist, this is anxiety. So pay attention to your child's stomach. And often anxiety will hit the stomach without really hitting the brain. And so even my kids will say, my stomach hurts. And I'll say, you're anxious. And they'll say, no, I'm not. And they are, because I know my kids. And they're totally fine when they don't have to do something that's provoking their anxiety. So look at the context of when your child is having physical symptoms. Stomach is the big one. Sometimes headaches, sometimes feeling dizzy. But the stomach is the number one sign of physical symptoms with anxiety. On to number 2. Avoidance is a big one. Now, a lot of times kids are not really articulate about things that are making them nervous or worried, and they're not going to necessarily tell you that, especially boys, unfortunately. My boy doesn't really talk about his anxiety. If I didn't know better, I would think that he's just really oppositional. So if your child is avoiding things to the point where they are having full-blown meltdowns, and that's not typical of them, pay attention to why they're having those meltdowns. A lot of times I'll see kids and the parents will say, he just refuses to do the dishes, or he refuses to take out the trash, and they look like they're really behaviorally difficult. And then when I talk to them, a lot of times they're not giving me the typical answers like, it's boring, or I don't want to do it. They're like, I'm afraid of bad guys in the backyard, or it's dark when I take the trash out. I even had that with my son. He had a complete fit about getting the trash around the house. And I was about to yell at him until I kind of thought, wait a minute, why is he acting like this? And I said, what's the worst part about taking the trash out around the house, not even outside of the house? And he said, the rooms are dark and I'm afraid someone's going to creep up on me, or I'm afraid someone's going to startle me. And I didn't even realize that it was anxiety based. I was about to discipline him. So pay attention to when your kids are avoidant. Now, some kids just avoid things because they're kids, but you just want to pay attention to the context of avoidant behavior. On to number 3. Okay, number 3 is all about anger. Now, some kids are just angry and they're dysregulated and they have an anger problem, or they're just regular kids who are mad, and that's totally fine. But there are a lot of anxious kids that look like angry kids. And so you want to pay attention to when your child's exploding. My 7-year-old doesn't get anxious, he gets angry. He'll come home and he'll explode. But then when I process it with him, or I figure out like, hey, how was your day? He will have a zillion things that he was anxious about that day. Now, my 2 girls who are anxious, they don't do that. They just cry, or they say, I'm nervous. They don't get angry. But some boys and some girls do. So don't discard anger. You want to take a closer look and say, what's going on? Because when you stuff anxiety all day long, you have to let that go. And you get home and you explode. It's not fun, trust me. On to number 4. Almost every single anxious kid I have ever worked with has sleep issues. If your child's having sleep issues, that could be an indication, with all the other symptoms, the obvious ones and the not so obvious, that maybe they're having anxiety. So ask them why they're having a hard time sleeping, because I really have almost never met an anxious kid that slept really, really well. So if you're struggling with sleep, that could be another sign. Number 5, the last one for today, is lots of questions. So kids ask questions, yes, that's totally normal. But if you have an anxious child, they take that to a level that is like supercharged. So if your child is like, where are we going? Where are we going? How long are we going to be there? Who's going to be there? What are we going to do when we get there? When are we going to come back? How long are we going to be there? How long will it take to get there? If your child's asking you a zillion questions, that could be an indication that they're anxious. Anxious kids are plotters and planners. They want to know what's happening, who's going to be there, what they're going to be doing, so they can mentally prepare. So if your child's asking you a lot of questions, then it could be anxiety. So those are the 5 most uncommon symptoms of child anxiety. That is by far not all of them. This is a very short video. And those are not the obvious signs of child anxiety. Those I don't need to go over because I think that you probably know what those are. But if you want further information on child anxiety, you can visit my website, which is anxioustoddlers.com. It's a website for everybody. I just named it that, and I don't know why I did that. Don't forget to subscribe because you're not going to want to miss part 2, 3, 4, and 5 when we get into the nitty-gritty of how to help anxious kids. Until next time, I hope you find the sparkle in every day. Take care.